grab a drink and snack, etc. I'm delighted to be able to introduce Lydia Hodges today from Coram. She can introduce herself in a bit more detail. But what I would say is that many of us, certainly those dealing with policy and the way policy interacts with practice, regularly use the data which Coram produce. So it'll be really interesting to hear her thoughts on sufficiency in particular, and generally speaking on the status of the early years. So Lydia, I'm lovely to have you with us today, and over to you.
Brilliant. Thank you, Daniel. Please shout if anybody can't hear me. I've been told I'm a bit quiet, so I've moved as close as I can to my microphone. But thank you so much, Christina, for inviting me to take part today. I'm really pleased to be joining you all. I'm sorry that I'm not there in person, but very grateful to Addy for the technical setup that's enabled me to beam in and join you. So as Daniel said, I'm Lydia Hodges and I'm the head of Coram Family and Childcare. I am new to Coram Family and Childcare, having started just a month ago, but I'm not new to the world of special educational needs and disabilities, having spent all 22 years, I think, of my career working primarily with children with disabilities and their families. I worked for 12 years at the National Autistic Society. I've run a parent partnership service, as they were then, what is now SENDIAS, and I've led family services in both local and national charities. I've been involved in CDC's work in various different guises over the years, and I'm particularly passionate about support for disabled children and particularly interested in equal access to early education for those children. And when I say equal access, I mean equal in terms of that early education meets those children's needs as well as it might meet the needs of their peers who do not have disabilities. So I will just hopefully move my slides along. So many of you will already be very familiar with us and what we do at Coram Family and Childcare, but I just thought I'd have a brief introduction to who we are and what we do. We are part of the Coram group of charities, and we focus on childcare and the early years to make a difference to families' lives now and in the longer term. We work to make the UK a better place for families by bringing together what we learn from our on-the-ground parent-led programmes and our research to campaign for solutions that parents want and need. So our parent-led programmes include our Parent Champions National Network, which has been running since 2007, and lots of you may have parent champion schemes in your areas. And they help families that are most likely to miss out on services in the places where parents would usually be. And there are several of our schemes that are focused specifically on SEND and meeting parents who have children with disabilities. And our research and policy work focuses on holding central and local government to account for doing all it can to remove barriers for families. We're committed to tackling barriers to access and inclusion and driving the change that's needed to make sure that every family can find the high quality childcare provision that meets their needs. And we know, of course, that the early years are a particularly crucial time for setting up a child's life chances, and our work aims to advocate for those children who are most likely to miss out on vital services. So a fundamental part of our research then into childcare therefore does focus on understanding the needs and experience of children with special educational needs and disabilities. So I was asked to speak with you today primarily about our annual childcare survey. That's now in its 23rd year and we publish that every spring. So we collect information from family information services, and by doing that and by asking primarily the same questions every year, that means that we can monitor changes year on year and identify areas for concern and areas for reform. So local authorities are asked a range of questions across childcare provision, and a couple of those questions is whether or not there is currently enough suitable provision to meet the needs of disabled children in their local areas. We know that a well-designed and functioning childcare system can be a key tool in tackling disadvantage, both by helping families to increase earnings and by improving outcomes for children. High quality childcare can have a positive and long-lasting impact on children's outcomes. But unfortunately, our research reveals that that potential is not currently being achieved, with far too many families unable to access childcare that does meet their needs. So our most recent survey then last year, so there's just a couple of things here that are overall statistics, which I thought might be interesting. So the first two are not necessarily specific to children with SEND, but what we found was a rise in cost from the previous year. So this is for a part-time place, 25 hours nursery place for children under 2, had gone up by 5.6% in 2023 from the previous year. And this is a pattern that we've observed year on year since the beginning of the survey in 2001, and it tends to track a few percent over the base rate of inflation every year. The report also found that childcare costs were rising at almost triple the speed of the previous year, at a time when families were already struggling to meet costs. So the next infographic there is just the average cost of a part-time childcare place for under 2s in a nursery in Great Britain. So how that relates then to children with SEND, and it revealed really an unacceptable gap in provision for children with SEND. Only 18%, so less than 1 in 5 local authorities reported that they had enough childcare spaces for parents of disabled children. That was a 3% drop on the previous year and a 7% drop from the year before. So that indicates that the situation is getting worse. And over the last decade, we've seen really a great variation in the sufficiency of childcare for disabled children. And one of the things it always reveals is, a postcode lottery, patchy availability across regions as well. So looking at that, here we can see how that sufficiency trend looks over the last decade. And really, it's remained worryingly low. So this shows from sort of 2013 to 2023. There are some interesting variations, I think, at key points over the last 10 years, but generally the trend is cause for concern. Particularly worrying is that dip in 2023, because it's really representing it's a step backwards. We're going in the wrong direction with this, not the right direction. And children with SEND and their parents just deserve so much more than this patchy and poor picture. Got another slide that I wanted to show you, just I think to illustrate the postcode lottery of that variation by region. So this chart shows the sufficiency across some thematic areas such as after school care, but it's that column in the middle that shows the percentage of local authorities who answered yes, they have sufficient childcare for disabled children in all of their areas. So I know that obviously this postcode lottery is something that you'll all be very familiar with in other areas of your work, such as access to health and therapy services, things like education, health and care plans. I mean, it's an all too familiar story, isn't it, for those of us who work with families with disabled children. And I think this just shows that it's the same in access to childcare. And it's a major barrier for families, as parents looking for suitable provision for their child will face a different set of challenges in different areas. Obviously, that creates different challenges for you as professionals as well. So just looking at that then in a bit more detail. So this shows, again, those percentage of regional variations, percentages of local authorities who are saying that they have sufficient childcare for disabled children. And I think it just really illustrates the differences between the areas. So 30% of local authorities in the East Midlands said that they had enough provision for children with SEND, compared to just 11% of local authorities in Outer London who were saying that there was enough childcare for these families. Now, Neither of those figures are good. You know, even that top 130%, that's disappointingly low. But I think that 19% gap between those areas really illustrates that unequal provision of services for children with SEND. And all of this data really points towards an unacceptable failure of the current system to meet the needs of children with SEND. Many young children will miss out on the key benefits of early education. And we know that high quality childcare can play an integral role in boosting educational outcomes and also provides a supportive, safe environment to learn and play with other children. And without that provision, disabled children are not going to be able to access those important opportunities and will miss out on a key opportunity to learn, connect with their peers before school. And the shortages also leave their parents without the flexibility that they need to work, may lock parents out of careers and important earning opportunities. And so, as well as the childcare survey, we also conduct research into other areas of early years childcare and education. And last year, we published this report, Tackling Disadvantage Through Childcare, with the Joseph Rowntree Foundation. And although this wasn't looking exclusively at families raising children with disabilities, we know, of course, that there's considerable crossover between the two and that families with disabled children are more vulnerable to poverty. I'm sure many of you will have seen the Childhood Trust report last summer, which identified that 71% of social workers and 83% of charities said that the cost of living crisis was having a disproportionate impact on children with SEND as compared to those without. So I think that, I think that case is clear. And what this report found is that the inequalities in who take up childcare remain, and families face a range of barriers to taking up that early education, including a really complex system alongside the shortages that we talked about earlier. An awareness of what people's rights are, of what those early educational entitlements are, is lower in deprived areas. So the awareness of, for example, the extended 3-year-old entitlement was at 91% in the least deprived areas and 72% in the most deprived areas. So you're looking at an almost 20% difference in how much people know about what they should be entitled to. And by freezing parents out of work, that by that lack of suitable childcare options just risks plunging more families into financially precarious situations, and then that cycle continues. So our other research, so this one is ongoing at the moment, and we're looking at barriers to take up of the early educational entitlement, which is funded by the Nuffield Foundation. As I said, that's in progress at the moment, and that will be the most comprehensive study to date, and looking at understanding how to support the take-up of the 15 hours early educational entitlements in England. So far, let's say it is still a work in progress, but the data is telling us that too many eligible children, especially disadvantaged children, do not take up their funded place. So last year, only 74% of eligible 2-year-olds were accessing the 15 hours of free childcare to which they're entitled every week. And this means that families are losing out on the enormous benefits of early education. It's a missed opportunity and one that exacerbates and widens the existing educational inequalities. We found that there were significant service level barriers to take up, particularly for those 2-year-old funded places, and that there were particular barriers for some groups of children, including children with special educational needs and disabilities. And you will all know, I'm sure, probably better than our researchers at the moment, some of the reasons for that. And that might be that parents have actually been turned away, or that they're not confident that their child's needs can be met in those settings, or they might be worried about the vulnerability of their children in those settings. But again, it does mean that eligible children with SEND are missing out on that vital opportunity, and that situation is only going to heighten existing inequalities for them. So looking ahead then to the future, we know that the government has committed obviously to much higher investment in the early years childcare sector. We're pleased to see that greater awareness of the need for reform in the spring budget. However, those proposed changes don't adequately address the systematic problems around accessibility for children with SEND. And in fact, our most recent research raises concerns that actually the proposed childcare expansion risks exacerbating existing inequalities between disabled children and their peers. So I was talking earlier about our 2023 childcare survey. Our childcare survey for 2024 for this year. So that's gone out and all the data has been received in. We're literally crunching it at the moment and working on the report, and that should be out there with you in the next month. But what we did with this year's survey was we took the opportunity to ask a couple of additional questions about the rollout of the upcoming childcare expansion. And last month we were able to publish an early release based on those questions. And it identified major concern among local authorities about whether there will be adequate provision for children with SEND. So many local authorities expect the rollout to have a negative impact on the availability of both childcare entitlements, and they're expecting fewer places to be available for children with SEND. So you can see here with this slide, it was 64% of local authorities that saw sufficiency of childcare places for children with SEND as a barrier or a significant barrier to successful delivery of the 30 hours expansion. And 55% saw funding to support children with SEND as a barrier or significant barrier to successful delivery of the 30 hours expansions. So without proper structural reform, the expansion, as much as we're pleased to see it, therefore fails to address those long-standing inequalities within the system and risks locking even more disabled children out of early education. I mean, we know that historically, as funded childcare has increased, provision for children with SEND decreases. And unfortunately, that sort of perfect storm of increased demand and reduced capacity means that provision for disabled children is further squeezed and children with SEND are more likely to be turned away. So further to that, our work has also identified significant shortages in wraparound childcare provision for children with SEND. So that's, childcare that wraps around the school day. And is provision for school-aged children directly before and after the conventional school day. Now, I know we're primarily early years focused here, but I know also that many of you will be working with children across age groups and interested in what happens next. So I thought this might be something that would be useful to include that you might be interested in. So this was a report that was commissioned by the Local Government Association after the spring budget announcement. And for that, we spoke to parents, sector experts and local authorities. And they felt that children with SEND were particularly poorly served by the current wraparound childcare market, especially because providers are not able to access additional funding for children with SEND. Most providers' income for wraparound childcare comes from parents' fees. So that means that any additional costs associated with specialist provision needs to be met through those fees. And in terms of the staff ratios as well, so we asked about, high child to staff ratios at wraparound childcare, but the feeling was that that doesn't always help with making the provision accessible to children with a range of additional needs. It's not always the answer. And in addition, ongoing difficulties in recruitment and retention in the sector. Also found that parents were concerned about finding qualified staff with the relevant training to support their children in wraparound settings. And in order, I suppose, for settings to be able to provide high quality childcare for children with SEND, professionals need to be able to have the training and the experience to meet a range of needs. It's not just about having the number of staff. They've got to know what they're doing as well and understand that range of needs that they might be presented with. So this is just a quote that I thought I would share with you from Ellen Broom, who is head of Coram Bath and looked after Coram Family and Childcare before I started. And so, what does this all mean then? We feel that this demonstrates that reform is needed to make the system more equitable and inclusive for disabled children. As I said before, we're pleased to see that investment from government. And I also do want to take the opportunity to say here that we know there are excellent local authorities out there. We know there are excellent providers out there doing brilliant, creative things to meet the needs of children with SEND. But overall, the picture is of one that's not fair and fails to consider the needs of all children and families. And the investment that's coming will not tackle those pre-existing structural issues, and therefore much more must be done to give children with SEND more options and opportunities within early education. So we believe that system reform is needed so that childcare policy can achieve its full potential for all children, and a new infrastructure that would support children's outcomes and give every family the flexibility to work, study, and care and be parents and a family. So in terms of our recommendations then, here we're at an important moment here with that funding, but also potentially a general election coming up, to reflect on the current early years landscape and identify what must be done to improve access to childcare for children with SEND. These are some of our recommendations. Some of these are things we feel that can be done now, and some of those will be longer term pieces of work. So increasing funding for children with SEND and simplify the funding application process. Reallocating the underspend from tax-free childcare. I don't know if anybody in the room has seen more recent figures, but I know that a few years ago it was sitting at something like 2.4 billion underspent in tax-free childcare. So we believe that should be reallocated to other areas of the system. We believe that the early years pupil premium should be brought in line with the primary pupil premium, and that the high needs block of funding for early years should be ring-fenced, and that there could be more done to support and give information to parents of children with SEND to address some of those barriers to take up. So we know that parents of children with SEND can face additional barriers to taking up their entitlement beyond simply availability of places. It might include, lacking awareness and understanding, fear of stigmatisation, as I said before, concerns over the ability of staff to deal with their child's additional needs. So it's not the full answer, but we believe it's part of the picture, that empowering parents to understand their rights, and that's certainly one of the things that could be done reasonably quickly and should be done. Couldn't fit them all in one slide. Obviously, we have high expectations and a lot of asks. So also then clear guidance for local authorities on how they are expected to address current shortages in provision for children with SEND. Like how to meet any additional costs associated with provision, how the extra funding could be used to meet those, and in relation in particular to thinking about wraparound childcare in relation to specialist schools, reconciling any expansion of wraparound provision with what can sometimes be quite rigid times with home to school transport. And a workforce strategy, which would include training, but also annual monitoring of pay and conditions, and a funding settlement for providers that guarantees the true cost of provision, sets out the conditions of receiving funding, including SEND provision, and also the physical adaptations to facilities or equipment providing one-to-one care, because those things should not fall to the family or to individual providers. They should be seen as a core part of the funding settlement. So to sum up then, I mean, I think for far too long, childcare shortages for children with SEND has meant missing out on vital opportunities in early education. We see it across our childcare survey. I'm sure you see it in your day-to-day work. And we have to make sure that all children can benefit from early education and that their parents can make genuine decisions about work and care. An accessible and exclusive childcare system, we believe, should be seen as essential infrastructure. So this has been a bit of a whistle-stop tour of some of our pieces of work. As I said, the 2024 childcare survey will be out really soon, within the next month. And we also are having a launch event of the research that I mentioned into the take-up of early education entitlements, that Nuffield funded project, in July, and the full report of that will be out in September. So do follow us on social media and on our website, keep up to date with what we're doing. Do feel free to get in touch as well. My details are there and our website. And I'm very happy to take questions now or for people to contact later on. And yeah, that's it, I suppose. Thank you so much for listening. Does anybody have any questions now?
Thanks so much, Lydia. I am, you can't see me on the camera because I switched it around, but I am here. We've got definitely one hand up, perhaps two in the room. I also encourage virtual attendees. Addy will be able to unmute you, I believe, if you are interested in asking questions. If not, you prefer putting it in the Q&A tab, that would be great as well. Yeah, so first question, if you could, I can't bring it to you, sorry. So there we go. Great. Oh, it doesn't go very fast.
No, it doesn't go very far. So I'm going to do that. So I'm not. I am sitting in front of the mic anyway. Yeah, and just really interesting. Thanks very much. I'm interested in the data around the provision that you shared earlier, and we've got that by region. But can you drill down into local authority? For example, if we want to look at we're based in a number of different areas, look at what we can do to increase provision in any of those areas. Do you have local authority data?
Yeah, we do. Yeah, so the data is collected by local authority area, so it's submitted by their Family Information Service. So we have that by local authority area. What we do for the survey is we do it in regions. Otherwise, it's just a really long list of 153 areas. But absolutely, we do have that. Yeah, we do.
Right. Can we contact you to get more information if we need to?
I mean, it might even, I don't think it is in the full report, but yes, you can, absolutely. Yeah, very welcome to do that.
Question over here. Are you okay to come up, or I can repeat it for you, but okay.
I'm interested to know, appreciate that the information comes from individual local authorities that are saying whether they do or don't have sufficient provision for SEND. I'm interested to know how each local authority is assessing that, whether they're all using a consistent way of deciding whether they've got enough. How are they determining if they have sufficient provision for SEND?
Could you hear that, Lydia?
Yes, I did. Yeah, the question was, I believe, how do local authorities come to that answer? Yeah, and I think that's a really good question. I mean, as I said at the beginning, I am quite new to Coram Family and Childcare, so the real sort of nitty-gritty of how they do that might be something I need to take away and find out, and then let Christina know, and she can pass that on to you. But I know just from conversations that I've been having with the team so far that I think that can vary how people answer that question. So local authorities, you may know, have to do childcare sufficiency assessments of their provision, and that's something that they sometimes do themselves, or that they sometimes get external organisations to do for them. And there is quite a variation in how they do that, how they look at what constitutes sufficiency in an area. So one of the things we're particularly interested in is that real super local area. So a local authority might say, yeah, we've got X number of families who have children in this age group, and based on trends we think this number of them would be likely to want childcare, and we know that, you know, we have this many children diagnosed with additional needs, but that based on trends we might have a number more, particularly in early years, who are not diagnosed. And they might say, right, so that's that number, and then we know we've got this number of places and how that matches up. But what we're really interested in is in a local authority area, well, how does that fit geographically, for example? Because if all of the provision is, say, in the northwest of a local authority area, and that area is really big, that can be a really long way. That might not actually be accessible at all for those families. And I think what we see with families who have children with additional needs is they're going to be travelling further because they're looking for the place that can best meet their child's needs rather than just what happens to be around the corner. So we're very interested in that. And what I would say in general is that I think it does vary in how local authorities do that. But I would certainly go away and find out a bit more about that, because that sparked a couple of questions for me as well. And then I'll send it perhaps to Christina.
Any other questions in the room? I haven't seen any in the virtual room either. Okay, does anyone have any questions for the partners from this morning about some of the offers available? Barry, you wanted to say something?
So yeah, just to chip in that we do provide training to parents. So it was very easy when I was like, I just wanted to flag that for one of the recommendations, because that is on the open access list on our event site, so you can go in and find that. But obviously we would love to do more of that. All our training is free for parents. There's only a limited amount that we can provide through the
Wonderful, thanks Mary. For those who didn't hear, Contact also offer entitlements, early education entitlements training for parents and carers so that they're aware of what they're able to access. Daniel, was there anything you wanted to add or a conversation you wanted to start?
No, I mean, first of all, Lydia, thank you. As I expected, it was very interesting, although a bit depressing at times to hear the data sharing. I'm certainly looking forward to the 2024 data to come out as well. I think we're a bit ahead of time. I think we'll probably break a bit early. And I think we've got enough food for thought for this conversation happening. So yeah, Lydia, thank you very much for joining us. And if you do send us any follow-up information, obviously we'll circulate it amongst our participants.
Thank you so much, Lydia. That was fabulous.
Thank you. And I just wanted to say again, you know, if people have got other questions like that or other ideas, because I think the childcare survey in particular will look quite different next year with the change in the landscape. So if there are things that you think that we should be focusing on, and particularly with me new in post, you know, now's the time, send them over. We're really interested to hear all of those ideas.